And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
So today I have Miss Josephine and we're doing a wax bite rim for a full lower denture and an upper partial. She does have some teeth that are missing and we are going to replace all of them on the lower and a couple missing on top. Here's what our wax rims look like. This is one of my favorite cases as far as wax rims because she does have teeth in her mouth that do occlude. A lot of the measurements that we need are kind of maintained with the occlusion that she has. For somebody that might have no teeth, of course, we want to measure VDO and VDR and make sure our midline and our, the width of our smile and everything is calculated and adjusted so that we can put teeth in her mouth that fit. The first thing that I do always, and a lot of times the assistants will do this for me, is they'll ask the patient to try in the wax rims. So I'll have you open here. And I'm going to want her to be able to bite tight. Now these plates are going to be, relatively loose. They're kind of just sitting until they're being bitten into. They're more or less resting over the ridge. Go ahead and bite for me. And I'll ask, is there anything that is stopping you from biting tight or putting pressure? And so a lot of times patients will close and they'll kind of jump out of the chair and say, I can't, absolutely not, it hurts on this side. And so is there anything that does hurt you? I know they're going to drop down a little bit there, but is there anything that's stabbing you or cutting you at all? No. No. It's okay. All right. And go ahead and open for me. So the next thing I'll do is take a look at where my bite marks are before I make any adjustments. I can see that it's hitting pretty heavily on the left side and it's also touching on the right, but really just a couple spots that are being bitten into. Can you grab me a knife? So I will take away a little bit of height in those areas that I know are the highest, and then I will place the wax bite rims into the warm water bath and allow her to bite tight to match her natural occlusion. And that will give us a good framework and a nice point to start as far as placing our teeth and trying those in. All right, so I'm going to shorten the height here a little bit. And now before I put them back in, I'm going to ask you to open and bite. Perfect. So yeah, really my canine occlusion on the left side is what's going to give us our vertical dimension of occlusion. Now I'm going to warm these up. And the next time I put these in, you'll feel the wax a little bit softer. You'll be able to bite in and really register where the teeth come together. All right, so I'll set these in here. And go ahead and stick your tongue out. Perfect. And you can relax your tongue. Sorry, it's a little too far back. There you go. And I'll have you open. And bite slowly. And you can bite together. And bite nice and tight. And you'll feel perfect. Now you can just bite and hold. Just hold closed, just like that. And you don't have to bite too hard, you just kind of hold so that the teeth are touching. Okay, and bite again. I'm going to make a small mark, so smile big for me. Show me as much of the teeth as you can, good. And so they will have an idea of where the midline is based on the occlusion, but I will mark again where that is for the lowers. Afterward, I will have you open, and I'm going to put these back on the model. And this model is how they are going to occlude and put your models together. And that's perfect. So we have something like this where we now can see the height of teeth that need to be placed in order to fill in all the gaps. The last thing that I would do is I will hand the patient a mirror And so we're just going to ask you about color. So a lot of times we want to improve color. Other times when we're doing something like a partial, in this case on the upper, we want it to blend seamlessly. So take a look at some colors here. This is for a try-in. So the color that you select may not be perfect today, and we will be able to try it in for you. So smile big. And so we're looking for yellow tones in A versus B, and sometimes grayer tones with our C shades. So let's see here. So this one looks close. It's a little bit darker than your other front tooth. Your front tooth here has a little more translucency. Let's see here. The best part about using the lab with Shatkin F.I.R.S.T is being across the street. We'll do a try-in, and once we do a try-in, you can see them in your mouth, and you can say, the color's not right, it's too bright, or it's too yellow, or the tooth is too big or too square. And we'll do the try-in, and we'll make our changes and our marks, and we'll give it back to them, and we'll do probably another try-in. So I think we'll probably pick this color. It's relatively close. Other than that, it's an easy one for you today. That's all I need from you, okay?
Okay.
All right, thank you. Thank you for joining us on the Monday Morning Minute. We'll see you next time.
Join us for our last advanced course of 2025. We're going to have a great lineup of speakers at this course. It occurs on November 20th, which is a Thursday, the 21st, which is a Friday, and the 22nd, which is a Saturday. It's a 3-day event, and Dr. Gordon Christensen will be lecturing on Friday, the 21st, and then in the afternoon when Dr. Christensen finishes up, we're going to see some great live surgery from Dr. Shatkin. The previous day, on the 20th, we're going to have Dr. Shatkin lecture. Dr. Tharp will be lecturing with us, and then Saturday is going to be a phenomenal day of education. We're going to be in our new preclinical lab for our hands-on demonstration. Dr. Shatkin and Dr. Tharp will be running that. But right before that starts, Dr. Tharp's going to talk about his 40 years of implantology, some of the things that have gone very well and some of the things that haven't gone so well. He's going to talk about that. We're going to talk a little bit about using your iPhone or your Android to take dental pictures, really nice pictures. And then we're going to talk a little bit about our hands-on and what to expect during the day. It's going to be a real great session. We look forward to having everyone coming out to Buffalo one last time for the year. And you'll get some hands-on experience using real bone in our new preclinical lab. So it's going to be a great day of education. I hope everyone has a wonderful week placing mini and mono implants. And we look forward to seeing everyone in Buffalo on November 20th, the 21st, and the 22nd. Have a great week.